for bradycardia, and we're in the emergency department. It's an unstable bradycardia. You receive a 5-minute notification of an inbound woman reporting nausea and vomiting, abdominal pain, and low blood pressure. By report, the patient is placed on oxygen and vital signs are obtained. You have to push the button a little harder, maybe.
And it might say convert over to that.
Do you have to have that on monitor?
Okay. It should.
Let's put it on monitor and see if it makes any difference.
Yeah. Or if you want, you could hook the leads up to the side. There you go.
Now it's on.
There we go.
Okay. Heart rate's 40. Respiratory is 14. Oxygen is 95% on 100% oxygen. Lady is 75 years old. What are your initial actions?
Initial action on this. Patient had, what was the vital signs?
No blood pressure.
No blood pressure at all.
It was 70 millimeters.
Unable
pop.
to obtain. Okay. So first thing I would say is that I'll hook the patient up to the monitor. Right here. Abdominal pain. Do we have any history with abdominal pain? Do we know? Like, is there causes of that? Do we have any past surgeries before we do anything? Or do you know if it's
Don't know.
Well, I initially would just do fluids right away.
Okay, how are you gonna get fluids in there?
Fluids. Start an IV. Let's get an IV started.
Okay, so
IV
just come to the
started.
emergency department.
And do a bolus of
Good
fluid right
IV.
away, please.
Okay, we're gonna do a bolus of fluid. Anything else?
Well, we try to do sweat pacing.
Yeah, what rhythm do you have?
Bradycardia going on right now.
Sinus Brady. Do we have a pulse?
You have a pulse.
We had 70 over palp, so.
Yeah, 70 over palp, so there's gotta be a pulse there. Okay. EKG shows a secondary type 1 AV block. Which I probably should have allowed you to identify. So how do we know it's a type 2 or type 1?
Due to the P node. One second.
Yep.
Due to the P nodes slowly firing before the.
It's kind of walking away.
Yeah, slowly.
With
getting
each one,
further,
it's
yes.
kind of walking away from it, so we know this is a second degree, type 1. Differential diagnosis, possibly acute coronary syndrome, abdominal aortic aneurysm, or sepsis syndrome. The initial focus is on the bradycardia. In there, is this considered stable bradycardia?
Unstable.
Unstable, okay. And you wanted to give a bolus, that sounds good.
Bolus right away. See how what the effects of that without any other interventions.
Okay. So we would call this unstable bradycardia, good.
Due to her being symptomatic and everything, start the atropine right away too.
Okay, you're gonna give a milligram of atropine?
1 milligram of atropine started, please.
In.
Okay, you sure you want a full milligram?
Yes.
Okay. Twice without change in the heart rate and blood pressure.
No changes.
No changes. So what's your next choice?
Next choice. Due to also maybe low blood pressure and everything, start dopamine. See that affect the heart and pressures as well.
Good, okay. Yeah, okay. So you recognize it. Hypertension, let's say we'll give IV atropine. And, okay, so preparing the dopamine infusion. Patient becomes unresponsive. Now we're unresponsive.
Alright, see if there's any breath at all and checking the pulse. See if the patient has anything going on.
I know we got this going on. Now what do we gotta do?
Alright, start
No
compressions.
pulse.
Initiate rapid response. Get airway I'm gonna get the defib on. Going to 200.
Are you gonna try to sync this rhythm?
I am not. It's just gonna be a big shock.
Okay,
Make sure it's 200. 200 started.
okay.
Charging. Clear patient.
Clear.
Shocking. Shock. Continue high quality CPR, please.
Okay, so how long are we gonna do CPR for?
2 minutes.
2 minutes, and then what are we gonna do?
Reanalyze. Check
Okay.
the pulse.
So any other medications that we wanna give this person now?
Epinephrine, if this continues.
How much epinephrine do you wanna give?
1 milligram, please. Get ready. 1 milligram, and ready for the next analysis after 2 minutes.
Okay. It's ready.
Alright, 2 minutes later.
Okay, 2 minutes has gone by.
Do you want me to give the
Check
MP?
pulse, please.
Any pulse?
Check.
No
No
pulse.
pulse. Alright. Continue CPR. Initiate 1 milligram epi.
1 milligram at the end.
Okay. We are still in VTAC. What's our next step? What are we gonna do next?
Next check. We're gonna shock him right away as soon as we can again.
Okay.
So I'm gonna charge him again for another 200. Charging. Charge.
Ready.
And this shit, sorry. What was that?
You can go higher voltage.
Oh, I thought 200 was the max. Get through this part.
Yeah, you can go to 3,
Okay, my bad.
but we're good.
Next time we'll go higher. We'll go 300.
Okay, and after that, we ended up with this. Okay,
Sicily, there's nothing, no rhythm at all. So we can continue the high quality CPR, get another milligram of epi started.
okay,
So the next check will initiate it
okay.
after 2 minutes of CPR.
You want more epi?
Yes.
Okay, 2 minutes is gone.
Alright, check pulse.
I have no pulse.
No pulse. Okay, it's initiate second round of epi.
Epi's in.
Okay, we're continuing your high quality CPR.
Continue.
Good job. And your waveform capnography suddenly jumps to 52.
Alright, well,
What are you gonna do?
see if there's a pulse. Check if there's a good pulse now.
Right, so stop your CPR.
Check if there's a
Check
pulse.
for a pulse. And now we are at
Alright, water complex, monomorphic VTAC,
okay. We've got a pulse.
0 pulse.
There is
Yeah,
no
How's the pulse? Alright, how's it
And
breathing?
they're breathing.
They're breathing? Alright.
Okay, so now we're gonna do Rosk.
You Ross, do you want a cardiovert this?
Let's check the
The
blood
only-
pressure.
Blood pressure first.
Yeah. What's PSVT on here?
Paroxysmal
Paroxysmal fit.
Yeah.
Okay.
ventricular tachycardia.
Okay, so it's supposed to be just VTAC.
Okay.
You know, they're
Yeah.
sinus tachycardia,
sinus
not
tach-
VTAC. Sinus tachycardia.
There isn't one on there. So.
There isn't one on there. We'll see there.
Okay.
Sinus tachycardia.
Okay, so now we're at sinus tach. We're going along at 126 a minute. She's starting to wake up.
Alright. So I would just stop,
Okay.
watch the monitor, do Ross protocol afterwards.
And okay, and what are we gonna do in our Ross protocol?
We're gonna
So she just came in off the street. She's in the emergency department. What didn't we get during all of this? History. Our H's and T's, and what could possibly have started this. The doc is here, and he's gonna wanna know all that stuff, right?
yes.
There, and then what's the next thing we're gonna do with this patient as soon as we get him stable? Here, we're gonna call a bird.
Sure.
Yes.
When we get him stable, we're gonna find him some place to land over in Boise where they're gonna take over. Okay. Anything else?
Think we kept him alive good.
Yeah, and they actually stayed alive. I thought maybe we were going down a road of not so much in here. So we got prompt high quality BLS. We got AED on, which of course is our monitor here. Recognize the Brady and the tachyrhythms. Early management of the bradycardia. Model effective communications. Okay, I think we probably could have improved a little bit on our communications. That is a circle communication. But other than that, I think you guys got this. Anything else you guys can add to it? Okay, good enough.
And cut.